So, welcome to Trails to Health Open Office Hours. We are talking about the elimination diet today, and this is Elimination Diet 101. We can go into a lot of details about the elimination diet, but the purpose of this is to give a broad overview. Specifically, we're going to determine the why, the what, and the how, and then some frequently asked questions. Let me move over here. So, why the elimination diet? What even is the elimination diet? How to do it? Full disclosure, I have done this. I mean, I don't have to disclose. I literally just did it just because I wanted to be able to empathize with my patients better. And there were some pitfalls that I had with it. I actually had to restart it at like day 14, and there was some things that I learned by experience. Can't say it was always pleasant. That can help you better. And so I have a few of those things that frequently asked questions and a couple stories throughout. So let's get started. So first of all, why the elimination diet? This beautiful thing here is from the Institute of Functional Medicine, and it's really helpful to help explain what it does. So first up here, we've got reduces inflammation. Inflammation is a huge term that I think is overused. Inflammation is a normal physiological homeostatic mechanism of our human body. But when it's in overabundance, then it can become pathogenic or cause actual conditions. Next, support a healthy microbiome. We're going to go into each one of these things, but I'm just doing super broad overview. Microbiome is what is the makeup of bacteria in your large intestine. So support a healthy bacteria. Next, down here, phytonutrients to heal the gut. There's data that shows leaky gut really is a thing, and we're going to talk more about that. Next, reduce toxic burden. There are toxins everywhere. If you've been outside walking, you've breathed in toxins. If you've, this is a whole controversial subject, but if you've been around plastic, you have toxins. Toxins are everywhere. So to reduce that burden helps our body be optimized. No calorie restriction, personally love that. And then promote a body awareness to food. How does a certain food affect me? We eat so many meals and so many snacks and so many different times of the day that there's not a keen awareness to if I eat this certain food, will it affect my body? And this really hones that in. Quick story, when I did the elimination diet, I did it through Institute of Functional Medicine. I had a coach, and it was actually super cool. And she's from the UK, and it's actually really cool because while I was making this presentation, her voice kept going through my mind in that beautiful UK accent, and I just heard her over and over. It was so endearing and just good memories, right? Because this is hard, and so it's so helpful to have someone walk through it with you and help address barriers and help provide resources and also just a place to be. That was the thing that my favorite was where we just caught up and I just felt heard. I felt understood. And that was a really reassuring, wonderful portion of the elimination diet for me. And that helped me, not only body awareness to food, but body awareness to situations. So up here, we've got identify food triggers. And so that's kind of why. And now let's kind of go into each one of these to provide a little more substantiation or evidence. Um, and yes, I'm going to have the same pictures for each one of these, and who cares? So first, reduce inflammation, right? Sometimes we think of inflammation like our knees on fire, and we're like, oh, what do I do? Like I have to decrease this, right? Um, and again, inflammation is normal. When it's excessive, it can be pathologic and cause disease. And then the thing about this inflammation is when there's inflammation in the gut lining or the small intestinal cells, it can weaken the tight junction. So analogy, right? Let's just think of, sure, AirPods. Okay, so let's say I have your AirPods in, and I'm not even using mine. I don't know why mine are in, but let's say I have your AirPods in, and there are children crying. They're being taken care of by your significant other, but you're trying to focus on something, and so they're being taken care of, and so you want to have a tight seal of your AirPods with noise canceling and maybe some white noise to not hear them. Well, if there is inflammation, if there are toxins, if there are things that are not ideal for that situation, that tight junction starts to leak. And you know what happens with AirPods when they start to leak? They lose that white, the background noise cancellations, and you can get that what you're not optimally in the moment starts getting in. And that's same with these cells in your lining of the intestines is when there's some inflammation and too much inflammation, there can be some weakening. And if you think about everything you put in your mouth, there are bugs and sure parasites. There's a lot of things that are on there. And if your cells aren't tight, it can get through and it gets straight to the immune system. The immune system freaks out, says, "What is going on?" Heighten the immune inflammatory reaction. And, the inflammatory cascade is going on. And the body's like, what do I do? And it's now little stressors that shouldn't stress you all of a sudden are like having your hair fall out. And you're like, what's going on? Well, one possible mechanism could be that there's inflammation inside the small intestine lining and the toxins and those things are getting through those tight junctions. So that's one theory. So an elimination diet can reduce that and help that to heal. Heal the gut. So this is kind of the next step. So the gut has trillions of bacteria. Some good, that's called commensal, and some not ideal. Those are pathologic, causing disease. And when we do this elimination diet, we are feeding the good bacteria, the commensal bacteria, and they are a little pharmacy. They give us little chemicals and other micronutrients and vitamins and help feed us in exchange. And so this elimination helps that. Um, cool little like fact, the intestinal lining is replaced every week. Resource there. And so this is important, right? If we're feeding it with the right stuff, then we're getting these healthy cells. Um, and so I think that's about it from there. So next is reducing your toxic burden. We talked about this a little bit, but through the elimination diet, we are reducing toxins. And as you reduce toxins, you're allowing your body to detoxify, and nutrients can facilitate that. A lot of people think the elimination diet is only elimination, but you could even reword the elimination diet as a repopulating diet, a abundance diet. Uh, Diet means it's not going to last long, and that's why we call it a diet. This is, 21 to 42 days or even a little longer. But if you focus on the abundance of things you can have, I think mentally that's way more helpful than thinking of what you can't have. Um, but anyway, the types of foods that we're not eating the elimination diet, those types of foods have high toxic burden. And so we're going to decrease that. How do you detoxify? High nutrients, also a lot of water. Some of my patients like to just set up, their aluminum canisters. Um, and they say, look, I've got four of these, um, and I'm going to drink those today. And they fill them up. They might put a couple, like a sprig of a mint leaf. They might put a strawberry in one. They might put a lemon in another and have some little fun variety. They might do, I love this herbal tea, cold. It's great. They might put a cinnamon stick in it, whatever. So they have their water, and that's what they're going to drink throughout the day. What contributes to the toxic burden? Genetics, certainly, even detoxification pathway inhibition, meaning some people can't detoxify as well. That's can be genetic. Next is your exposure, right? Do you go on runs in the forest or do you go runs next to busy roads? That changes how much toxins you have. And then diet, right? Do you have low fiber, high fiber? And I like to use Chronometer. Fantastic substantiated app. I've actually talked to the owner and they are very committed to their mission, but you put in food and it can give you the micro and macronutrient content and you can see how much fiber you have. Other things, MyFitnessPal, other things can easily track that, but I like Chronometer the most. All right, so next, promote body awareness. We kind of talked about this, but there's just so many foods. I'm going to repeat myself. There's so many foods that we're eating, and it's really hard to identify one. But if you're eliminated a lot of the pathogenic, uh, difficult foods, um, like through the elimination diet, right? And then all of a sudden you add just peanuts, whole peanuts, and all of a sudden you have a reaction. It's much more reasonable and scientifically substantiated to associate those symptoms with that one new food that you reintroduced. So that's something. And then what's also cool is you can enhance your tastes. And anyone that's kind of been on a diet or cleanse or whatever before has noticed like, whoa, I'm not having artificial sweeteners, and all of a sudden I have a carrot and the carrot's sweet. Whoa, corn actually tastes sweet. And that happens as you eliminate things that can detonate the senses. What else? Identify food triggers. This is a great opportunity to kind of talk about the difference terminology of an allergy, sensitivity, and intolerance. So specifically an allergy, a food allergy, and as a physician, it's important to differentiate this with allergies and sensitivities because a lot of people think sensitivities are allergies, but an allergy is an immune response that is immediate, and anaphylactic is determined as at least two body systems being affected. You don't just have to have your throat swelling. You could have hives, and you could have another body system that's on alert that that then correlates at the same time. So that's an actual allergy. This is severe, can be life-threatening. Someone that has an identified food allergy or allergen usually has carrying an EpiPen, and they know how important that is. And if you don't, then you should get with your provider. I'd love to be your provider if you're in Arkansas, and help you get that EpiPen to carry. I want to keep you safe, right? Because it happens. Sensitivity is a delayed immune reaction. So these are foods usually with specific gut microbiome that causes immune system reaction. Hey, something's not right. Something's going on in my immune system um, because of the food I've eaten. And then lastly is an intolerance. An intolerance is a reaction to a component of food. You can think of like lactose, you can think of histamine, you can think of monosodium glutamate, that's called MSG, and that usually is an intolerance because the body doesn't have an enzyme to break it down, and they just can't tolerate it very well. So I hope that kind of clears up a little bit. I think it's also an important distinction to make when speaking to your physician. They would appreciate it, and it's also helpful for your awareness. So quick little side note. Okay, so that was the why, and I hope that bolstered your desire, if it's right for you, to do the elimination diet. Um, so food allergy testing and celiac. So first, let's talk about food allergy testing. So food allergy testing is not reliable. There's a lot of different ways you can do it. And a lot of people I want that blood test to tell me bananas I'm quote allergic to, right? Or sensitive to. Um, or if they have MSG, maybe you have an intolerance, right? But people really like that, but it's just the substantiation is difficult. There's a lot of different types of tests. They can do the RAS test, they can do the serum test, and it's also hard to really like pinpoint exactly what symptoms are caused by what food. That link is hard to make. Okay, and another thing is celiacs. Celiacs is a real condition, autoimmune condition that where basically um, basically what happens is you have all these, they're called villi, microscopic villi in the duodenum mostly. And when there is gluten, the body has a specific reaction to it and will actually start attacking its own cells. And what will happen is for someone to be diagnosed with celiacs, the gold standard is to have them eat a lot of gluten. Let that body immune response occur, and then the villi are all blunted and small, and then a doctor will go in through the mouth, down the esophagus, through the stomach, and into the duodenum, the first section of the small intestine, and will take clips, snips of the small intestine. And don't worry, they're replaced after, what, 3 days to a week. And we'll take snips, do like 5 to 6, whatever, clippings, and then another doctor, a pathologist, will look at it under a microscope, and will look at specific criteria, um, and determine how blunted those villi are for a diagnostic. There's 3 stages, and we could get into that, but um, That's exactly how you diagnose celiacs. It's called the Marsh type, is how blunted those are. So some people think, hey, I have celiac disease, and the gold standard treatment, or sorry, diagnosis is that, but the elimination diet can also help where they may have a intolerance or a sensitivity, and lo and behold, it's maybe just a component, or it's just highly refined gluten, or it's just gluten in specific types of wheat. So there may be some of those associations, and this is where some of the elimination diet can help. So, okay, we're still on the why. Common food allergens and symptoms. Um, Let me just kind of, you eliminate more than this, but the wheat, milk, eggs, corn, and soy are things we eliminate in the elimination diet. And these are all the symptoms that you can get that could be associated with food. I mean, asthma can worsen with food, and there's great evidence for there is much evidence for that. Autoimmune conditions. You think about foods you eat heightening the immune response, and all of a sudden the body builds an antibody to its own system. It's an autoimmune disease. Bladder pain, sinus drainage, always runny nose, bloating, diarrhea, gas, heartburn, eosinophilic esophagitis, depression, mood symptoms, muscle aches, migraines, fatigue, skin conditions, and the list goes on. So sometimes we have these symptoms, and we're like, give me a med, fix this. And it's like, well, if you want to fix your shin that's really painful, we're going to stop hitting it against the desk instead of just get a painkiller. Uh, that example is from Michael Greger, who I look up to a lot. But anyway, so what is the elimination diet? Here we go. So enjoy these foods. Focus on enjoyment. Colorful, rainbow, whole foods, phytonutrients, animal protein. Yes, animal protein. Um, Organic, pro and prebiotics, non-dairy milk, eating with other people, and what to avoid would include gluten-containing grains, dairy products, pork, beef, corn, eggs, peanuts, shellfish, coffee, caffeine, alcohol, chocolate, and refined sweeteners. Each one of these things can have a role in your health and make health worse. So there's an awesome printout that I give my patients from the Institute of Functional Medicine that shows exactly, hey, I want a veggie, and has a huge list, just like here. All the veggies you can have, colorful rainbow, palette's amazing. I recommend eating seasonally, seasoning with herbs that are fresh, but all these things you can eat, and then reminders of things not to eat within the veggies. Okay. Same with grains. There's a ton of other grains you can have. Certified, gluten-free, oatmeal, ton of other grains, quinoa, legumes, a whole food group that I think is highly underrated in America. Man, that stuff's just incredible. Blows me away how much we should be eating legumes. You have lentils, you have beans, you have peas, chickpeas, all these different amazing legumes. So I'm going off. You get me on talking about food, I go off. All right, so I think we're done. We're done with this slide. Next, reintroduction. So after 21 days, usually 21 days, because that's the time it takes for our immune system to calm down after eliminating the foods that reactivate our immune system through the gut. So once our symptoms have really improved, at least 21 days, then we begin the reintroduction phase. And your elimination diet is only halfway over at this point. It's really important to see it like this because 21 days of eating like this is challenging. When I did it, it was difficult. And there were some really frustrating moments. What had happened is I was doing this for 14 days, and we were working really hard. My wife was on board, and no, she was supportive. Excitement's not the right term. She was supportive. And all of a sudden, I looked at the nuts I was eating. I had mixed nuts. I didn't eat peanuts, but I had mixed nuts. I also realized they were roasted in peanut oil. You the recommendation is 100% compliance to the elimination diet so we can accurately associate foods with symptoms. I was like, this is stupid. I don't want to do this again. This is challenging for me and my family, But what did I do? I said, my patients are going to be here and do this. I'm going to do it. I'm going to start over again. And I got different nuts that were not roasted in peanut oil and started over. Why did I talk about that whole thing? Oh, because that 1421, are we at 35 days? And then I still have to do it with slow reintroduction. And you have to remember that, or else you're just like, all right, I'm done. Cool, eat whatever I want. Well, that's pointless. I would argue you're missing the whole mark of doing the elimination diet. So, what do we do? So, with 21 days, symptoms improve. Now we reintroduce, and you reintroduce only one food for the next 3 days. And day one, you usually have 2 to 3 servings. And here's a caveat: it is important, it is vital for when you reintroduce foods to reintroduce them in their whole form. Edamame is a soybean that's a lot better than than uh, tem than like a tofu or a soy milk. But it's okay if you still do soy milk. But I would recommend, hey, you've already done this for 21 days. Surely you can stick with this. Just do the edamame for a day, okay? And then you can add a little more processed, but you really want to make sure it's as clean as possible. So you're just reintroducing that food and seeing how your body reacts. If there's no reaction, you're tolerating it fine. Move to the next food. Stay on what you've eaten and only include that one new food up to that point. Okay? Don't go eating beef and tallow and all these other things and pork and oh hey, my soybean was fine. No, stay where you are. All right. Let's see. Is there anything else with the what to reintroduce? Let me just see. I had made a couple other notes. Um, there are a ton of different data that I could talk about with the foods. If we have time, we'll come back to that, but I think we're going to say that for a different time. So, reintroduction, some other examples is like whole wheat spaghetti noodles, not pizza, not lasagna. Those are laden with food additives. They're laden with dairy. There's laden with other things. So just whole wheat pasta, or sprouted wheat in the morning. Um, dairy like taste cheese from cow's milk. Try that. No reaction. Try cheese from sheep's milk. I don't even know where to buy that, but if you eat that, use that as one of those foods. And then goat's milk, do that again. Now you've tested each one of these cheeses. Usually fermented dairy is less reactive than non-fermented. Um, but let's see. Oh, another thing, chocolate, right? How do you isolate chocolate from artificial sweeteners, from dairy, other things, other oils? Cacao nibs, that works. Do some cacao nibs. Give that a shot. You can do that for 3 days. I have faith. I have trust. You can do this. You got this. Um, so if all of a sudden you're eating a food and you have some reaction, you have maybe your headache comes back. You're like, whoa, I haven't had a headache for a month. This has been amazing. And I just had dairy and here's my headache. Well, you stop that food. You continue with reintroduction of the other foods, and about 3 to 6 months later, you can try to reintroduce it again. All right. Another thing, what if you're reintroducing, you're like, I think it was this food, but there might have been an additive. Um, shame on you. No, 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 no guilt throughout this. You should never have guilt and shame through this. We're just experimenting. It's a, it's a joyful discovery is how we can think about this. Okay. No shame or guilt. So anyway, if you're like, I don't know if this food really gave me that reaction or not, let's go back to the dairy example. You might say, I don't even know. Well, you stop, wait until the symptoms are clear, and then you can reintroduce that food. So if you want to do that with dairy, you could. But if you're like, that totally was from the dairy, then we stop it for 3 to 6 months. Unsure, um, unsure, wait till symptoms improve, reintroduce. If you are sure, wait 3 to 6 months and then reintroduce. And what's interesting is some people are like, changing up food is difficult. And I was, talking to a few people that have done this and that are still stop certain food. I'm like, how do you do that? Like, what's your motivation? And they're like, look, when I unequivocally know that when I have gluten, my psoriasis flares up, it is a no-brainer for me. It is not difficult. And that's, I think, one of the beneficial, you know, situations with the elimination diet is you can associate this food so strongly, right? All right. I would love to share with you how to fail. Okay. And I may or may not know some of these by personal experience. So first thing, if you want to fail, don't get any like sl don't get any variety of foods. Just have like already what's in your pantry and just eat that. That's a sure way to fail. Like, hey, I'm doing this elimination diet, and what's in my fridge? I can have celery sticks. Awesome. That's all I'll eat for 21 days. That's one way how to surely fail. Next, no preparation. No preparation shopping, no preparation meals, no preparation um, like your go-to breakfasts. What I actually recommend is get three snacks, get three breakfasts, three dinners, three lunches that you just can really enjoy that have a variety of all the phytonutrients and you know vitamins. See that UK accent's coming back. I love it. Um, that was from my coach. But just get those three meals and three snacks and stuff to be able to have a bolstered preparation. It's like you're going to go on a camping trip. You're not going to just go and say, I'm going to live off the land. That's really difficult and takes great skill. But if you're like, hey, I got my bag, I got someone here to help me, and I've got, the food that I'm going to eat, and I've got a hatchet, in case I get, I need it, and there's all these things. So that's kind of how to do this. So prepare. But back to how to fail, be hungry the whole time. Just be hungry and just say, I'm only going to eat during meals. I'm not going to have any snacks. I'm going to muscle my way through that. That's a great way to fail. There's no calorie restriction in the elimination diet. And because there's no calorie restriction, um, you can eat whenever you want. And this is really liberating for a lot of people. Like, I don't have to count calories. You don't. It's not a weight loss. This is not a weight loss diet. I happened to lose 5 pounds and I was like, oops. Um, and got that back, but that's not the point. And so when you're hungry, you eat. All right. Other way to fail. Spring this on your partner last minute and beg for their help. That is a great way to fail. Because it takes a toll on everyone in the home. Another one, um, go out to eat often, especially with other people. This is a great way to fail. I, way quick, me and another allied health professional decided to go out to eat while I was on the elimination diet. And I was like, okay, this is gonna be tricky because I'm super committed to this. And I called restaurants. I found one here in Bentonville was Co-op. And I told him, I was like, look, I am a doc and I'm trying to find ways for elimination diet to help my patients. And I'm looking for a gluten-free and soy-free and corn-free and no, shellfish. And they're like, we're a certified center for that. And our chefs are trained in that and we can do that. And I was like, what? You're the bomb. So I wrote down exactly what meal to get there and got there and got it. And it was like a good experience. But other than that, it would be absolutely miserable, especially if you go hungry to a restaurant with friends and you're like, Psst, waitress, like, hey, I can't eat this, and this. What do you have for me? And they're going to bring out, what are they going to bring out? Water. Hey, I hope you enjoy your meal, right? So, a couple mothers, don't drink any water is a great way to fail. You need to flush out those toxins. Quick little side note, the first couple days of an elimination diet, there can be a toxic load that needs to be eliminated. And so water drinking is crucial. When I did this elimination diet, I had a headache. Like around day 3, I don't get headaches very often, like at all, like once a year, if that. And so just recognizing that can happen. Some people get flu symptoms. They kind of feel really sick. Ton of water, cruciferous vegetables. You've got kale, you got broccoli, you got cauliflower. That can help with that toxic burden elimination and also like work with your physician. Like that's what they're there for. And so anyway, what else? Another way to fail is do this when you're sleep restricted. Like that's awesome, right? Attitudes are great when we're sleep restricted. Uh, also do this when you're traveling. That would be an awesome way to fail. What else? I've got a lot of others, but that was most of them. Okay, so let's go into a couple of frequently asked questions and then we'll be done for this intro. And I hope this has been helpful. If it has, Smash the like button. Love to have you follow as well. I'm interested in helping you learn about functional medicine and learn your body to optimize your life, to connect with other people, to connect with nature, to fulfill your purpose that you're passionate about. I want to help you with that. So happy to have you follow along and committed to helping you. So what if your symptoms don't resolve? It's important to ask yourself the question like, was I 100%? Like, did I do this 100%? Was it something else? And I think that's my next slide is like, could it have been a histamine food or an oxalate rich or salicylate or nickel, nightshades? I always think of Harry Potter when I say nightshades. There are other types of foods that you may consider eliminating. So usually what happens if an individual has done the elimination diet for 21 days, then all of a sudden they may say, I still have symptoms. Then maybe with the functional medicine practitioner, we may say, let's try to eliminate, maybe let's work on oxalate-rich foods or histamine-rich foods, etc. Um, Histamine are like avocados or fermented foods, nuts, spinach, tomato. Oxalates or some spinach, Swiss chard, and that could also be for those that get kidney stones. Oxalate can sometimes be the precipitant. All right, next. Why are legumes causing me gas and bloating? Well, it can happen. Did you know that there is actually, um, you can actually get like food poisoning from eating dry, hard beans. Um, it's important to to soak them and do a couple other things because legumes can cause more gas. And so some things you can do is you can just gradually increase it. Don't like go to cups and cups of beans. Like I usually eat, don't do that on day one. Do that over about like 1 to 3 weeks. Soak them usually 1 to 6 hours before you cook them. Use a pressure cooker to cook them. If you have canned, um, if you have canned legumes, drain the water, rinse it. That can help a little bit, and just try a few of those things. Um, and then could something else skew the results? Absolutely. If you were reintroducing a food, but you had a really stressful day, or you were traveling, or had poor sleep, or all that combined, uh, kind of get back in sync with your body and then reintroduce one of those foods. Absolutely, those things can skew results. Each one of those things can cause an immune response. Our immune system actually can weaken from those things, and a lot of other downstream effects. Who is this not for? And this is important. Maybe I should have said this first, but this is not for individuals that are pregnant or breastfeeding. This is not for children, um, unless there's a trained physician in place that is comfortable doing this for children. There can be a lot of downstream effects. If an individual is underweight or has nutrient deficiencies, eating disorders, or a challenging relationship with food, this may not be a good idea. This can just worsen the symptoms and worsen the situation. And each one of these it'd be important to like walk through this. Let's say that there is someone that has a challenging relationship with food, and we really still want to do this. Well, that's where a health team comes into play. And you have a mental health specialist on your team. You have a medical specialist on your team, and you have a nutritional profession on your team. Like it's like a certified dietitian. Um, and so not just a nutritionist, but those those individuals can be helped. But again, that, you know, group team is really important. A couple other things, risks. This does require supervision, functional medicine provider. If you do have a history or an individual has a history of food allergies or anaphylaxis, if first they need to work with a food allergist, and that should be they should be on their team. And then as you do the elimination, reintroduction can cause a different food allergic response. And so this has high alert, of some of these allergens that weren't an allergen before after elimination diet. Sometimes they can have another immune response. Um, and that's from the Atopic Dermatitis Guidelines panel in 2023. So that's just important to know. So resources for individuals that are IFM certified. We have the Elimination Diet Food Plan. Let me try to get these a little bit bigger. With a food list that I was talking about, a weekly planner with recipes, diet, nutrition, and lifestyle journal, which is important, symptom tracker for reintroduction, hidden food allergens, etc. So These are all resources that are important to use. So I just want to first, I want to just say thank you. It's been awesome to be with you. I hope this has been beneficial to you. If you're interested in doing an elimination diet with a functional medicine practitioner, board certified, physician, I would be more than honored to be your doc. Just sign up for a discovery call. I'll drop that down in the comments. If you don't know how to get to the comments or the show notes, then you go to my website, which is Trails to Health NWA. That's for Northwest Arkansas. Trails to Health NWA.com, and we can connect. Have a blessed day.